Welcome to the St. Jude Center for Rehab and Wellness. My name is Lena Lloyd, and I'm a pelvic floor physical therapist here. If you're watching this video, you likely suspect or you've been told by your healthcare provider that you have weak pelvic floor muscles. Leaking when you cough or sneeze, having a heaviness or a bulging sensation in the vagina are all signs of having a weak pelvic floor muscle. However, there are things that you can do to help, and over the next few minutes, I'm going to explain how we can help you do that. First, I'd like to go over the pelvic anatomy. So what I have here is the bony pelvis, and underneath this all are the pelvic floor muscles that hold us together from the bottom. And so the pelvic floor, or the floor of our torso, really serves three functions. One, it will physically support our pelvic organs, which include the bladder, the uterus into the vagina, and then the rectum. Two, it will keep us continent because it pinches our openings or the urethra in the front and the rectum in the back. And lastly, it serves for sexual function. So let's talk about why you may leak. So when you have leaking, it's because the pelvic floor muscles aren't strong enough to pinch the urethra closed. So that extra pressure from that cough or sneeze causes the pelvic floor muscles to give out, and then a little leak comes through. You may also notice trouble holding gas or maybe some bowel leaking. And that also means that you have pelvic floor weakness in that your anal sphincter muscles just aren't strong enough to pinch the rectum closed. And lastly, as I mentioned earlier, pelvic floor muscles will hold your organs like a hammock. And so if your hammock starts to get lax, everything sitting in the hammock is going to start to slip down too. It's important to be assessed by your healthcare provider to make sure that you should be doing Kegels because it's not for everybody. If you've been instructed to do Kegels though, let's discuss how we can do them correctly. First, I want to define what happens when you do a Kegel. So when you do a Kegel, you are closing up all of the openings in the pelvic floor, which includes the urethra, the vagina, and the rectum. And not only do these muscles close up the openings, it will also lift up. To do a Kegel, you need to correctly identify these muscles. And to help you do that, I want you to imagine trying to stop the flow of urine. If you've ever used a tampon, think about the motion of trying to grab a tampon and pull it up higher into the vagina. You can also think about trying to pull your labia together. For those who are having trouble with gas or bowel incontinence, think about squeezing the anus and pulling in as if you were trying to stop gas from escaping. If you have a really tough time sensing that, do a stop test. And that means you're going to try to stop your flow in the middle of urination. And if that flow is deflected, if it slows down, if it stops, you've got the motion right. We don't encourage people to do that regularly, but you can do a stop test occasionally just to identify those muscles. Once you can do a Kegel correctly, let's practice coordinating your breathing. So that means I'm going to inhale and completely relax the muscles, and as I exhale, those muscles are going to pinch closed and lift up, and when I'm done, I'm going to completely let go. And we want you to do that 10 times. Inhale, prepare. Exhale, close, and pull up the muscle as you exhale and completely let go. When you're done, we like you to practice holding for longer periods of time. We'll start with a few seconds, eventually working up to 10 seconds consistently. So to start doing Kegels, we recommend you do 10 quick ones, your 1 second holds, and then 10 long ones, and you do that 3 times a day. One of the things we see very commonly is a butt or a thigh squeeze, and so you will see this whole lifting up of the body when someone tries to do a Kegel, and that tells us that we're using a lot of extra muscles and not really isolating the pelvic floor muscle. When you do a Kegel, nobody should know that you're doing a Kegel. The second thing that we commonly see is breath holding. So people will tend to almost try to bear down a little bit and hold their breath as they try to Kegel. As I mentioned earlier, you want to try to exhale. You can also count out loud to help you with that. The last thing is sucking in your Kegel. Also not a great way of doing your Kegel. So I hope you found this introductory video to doing Kegels helpful. Remember that Kegels should be done frequently to build a strong pelvic floor and then done regularly to maintain a strong pelvic floor. If you feel you are not making enough progress or you just need some guidance, please ask your doctor to see a pelvic floor physical therapist. Thank you for joining us today.